Hello, everyone. Today's training is about pain and communication and improving comfort and care in elderly patients. Why does this matter? Well, pain is often unreported in elderly patients. Many of the elderly patients don't speak up about pain, whether it's due to fear, confusion, or thinking it's normal aging. If we don't communicate effectively as a team, their pain gets overlooked. So comfort equals quality of life. You are the patient's advocate. Next, we're going to talk about statistics. So numbers tell a story. When we see that 50% of our residents are in daily pain, we have to ask ourselves, how many of them are suffering in silence? The fact that 1 in 3 cases go untreated is often a failure of communication, not a lack of medication. We can't treat what we don't identify. Did you know that in long-term care settings, residents with dementia receive significantly less pain medication than those without cognitive impairment, despite having the same underlying health conditions? And do we know why? Well, it's because the patients with dementia, they often can't verbalize pain. And sometimes if they're grimacing or doing something, sometimes it can come off as them being a little agitated just because they can't remember stuff or they have dementia. So this is why they tend to get medicated less, because they don't have that, because of the cognitive impairment. Understanding pain in the elderly. Elderly patients may say, "I'm fine," but show signs of pain. We must assess beyond their words. So chronic pain is like background noise that never stops, while acute pain is like a sudden alarm. Many of our residents are stoic. They were raised not to complain, to keep things to themselves. They also fear that if they admit to pain, they'll lose their independence or be drugged up. We need to reassure them that managing pain actually helps them stay independent. Signs of pain, and we're talking about nonverbal. So this is where your clinical detective skills would come in. If a resident who is usually sweet, they're always so nice and so pleasant, if they start pushing you away during if you're changing their dressing, if you're helping them to get dressed, that agitation is likely a pain response. So look for the tight face or the way they hold their body. Those are their words when they cannot speak. So I threw this in here a little bit early just so that we can make sure that we're all on the same page and that we're actually paying attention. So we're going to do a little quick test your knowledge. Which of the following is nonverbal sign of pain? Is it A, increased confusion? Is it B, refusal to eat? Is it C, gritting teeth? Or is it D, all of the above? Which one of the following is nonverbal sign of communication? If you guessed D, all of the above, then you are correct. You see, I was trying to see if you were paying attention. If you go back to the slide that says signs of pain, nonverbal, all of those are actually listed there. So just trying to see if you're paying attention. Communication with patients. Use simple, clear language. Be patient. Make sure you are listening. Use the scale of 0 to 10. Keep it simple. Instead of just saying scale your pain or rate your pain 0 to 10, try, does your knee hurt right now? Use the FACES scale if you have that. If not, you can always find that online. But use the FACES scale for those who find numbers confusing. And most importantly, give them time to answer. Their processing speed slows down with age, so wait at least 15 minutes for a response. Communication between staff. Report all changes. Make sure you are doing your SBAR, which is a situation, background, assessment, and recommendation. Make sure you document daily. If you are doing a shift change, if you're leaving one resident and someone else is coming behind you, you as that person, that aide, that nurse that is coming behind that person to relieve them, should be doing an assessment on your patient just to make sure that nothing was missed. You should always get report to see if anything changed. So don't just say he's acting up. Say something like Mrs. Smith is grimacing during his morning walk, which is new to me. I think his hip is bothering him. Can we check his PRN meds? Something like that. That covers your entire SBAR, and it shows effective communication between you and that staff member. What happens when communication fails? Increased suffering, delayed treatment, injuries. This is the cost of silence. So untreated pain leads to falls because patients try to move differently to avoid the hurt. It leads to behavioral issues that might get them prescribed antipsychotics that they don't really need, when all they really needed was an aspirin or just to be repositioned. So how can we help? Well, pills aren't the only answer. Sometimes shifting a pillow, just repositioning them, applying a warm compress to stiff joints, or just putting on their favorite music can lower their stress or lower their distress. These nursing interventions are often our most powerful tool for comfort. So playing some calm music that will help distract them, making sure that the environment is calm. Medication awareness. You want to monitor effectiveness for the medication. Watch for side effects like sedation, confusion. If we do give medication, our job isn't done. We have to circle back. Like, did it work? Is the patient now so sleepy they are at a fall risk? In the elderly, start low and go slow is the rule for meds, but monitor them closely is the rule for nurses. So just make sure you remember that. Start low, go slow when you're doing meds. Also, did you know that many pain medications can cause constipation in the elderly, which creates new pain? So they're already in pain, and now they take something for pain, and sometimes it can cause more pain. So always monitor for side effects to prevent a prescribing cascade. Special considerations for dementia patients. For dementia patients, the pain aid scale is your gold standard. That's the scale you want to use. We look at the breathing. We look at vocalization. We look at their body language because a lot of times they're nonverbal sometimes. Remember, agitation is a form of communication. Treat the agitation by looking for the pain. And now it's time for some review questions. Let's test your knowledge. Scenario number 1. Miss Johnson becomes agitated, refuses to eat, and yells at staff. What should you do first? Should you ignore the behavior? Should you report for discipline, assess for pain, or leave patient alone? And the answer is assess for pain. Remember, behavior change equals possible pain. Scenario number 2. A patient says, "I'm fine," but is grimacing and not moving. The question is, what is the best action? What is the best action? Is it document no pain because the patient said that they're fine? Is it offer pain medication and assess further? Is it C, walk away, or D, wait for the next shift? And the answer is B, offer pain medication and assess further. You have to see where the pain is located, how severe the pain is. Sometimes they can point, or sometimes when you're looking at them, they're actually guarding a part of their body. Your role as the healthcare worker. So this is your mission statement. Being an advocate means being the one person who doesn't walk past a closed door when you hear a sigh. You're going to observe and report. That is our clinical duty. But communicating clearly and providing comfort is the heart of what we do. We are the bridge between, the patient in distress and a clinical solution. We're that gap between the patient and the healthcare provider, because you're spending a lot of time with that patient, and sometimes you get to see things first. You are the eyes and the ears of the healthcare team. Some key takeaways. If you remember nothing else from today, from this training, remember these 4 things. Pain is often hidden, so you have to go looking for it, especially in the elderly. Communication saves lives because it prevents the downward spiral of untreated symptoms. Every behavior you see, from a frown to a yell, is a message. Your job is to assess, report, and act. Make sure your patient is okay.